And the next project I would like to talk about is KundiG, which means being smart and skillful navigating through the healthcare system. Mrs. Seidel is the head of the Patient University, an initiative that was founded in 2006 and 2007. Since 2015, she's been head of the National Coordination Board of INSEA. She is working at the Medical University Hannover, and she's responsible for epidemiology, social medicine, and health system research. And she studied social work, but also education, sociology, psychology, and adult education. And now the floor is yours. Thank you very much for this introduction. I would like to welcome everyone here. I'm pleased that I get to be here and I get to present the KundiG program. It is a training program. It means navigating through the health system in a smart manner. Mr. Schwarzer, Professor Dr. Schäfer, they both have said that digitization of the healthcare system is important. This is a transformation process. We are all pioneers. It's not being used a lot, although there are already great offers. Unfortunately, the majority of the German society is not yet very literate with regard to digitization. So digitization does not work without digital literacy. Mr. Schwarzer has already broached this subject. So we need to be able to use digital offers. We need to be able to find it, understand it, assess it, and use it. In our legislation, we find a section that was introduced in 2019, which is Section 20K in our social code, and it actually made it mandatory for our Saturday health funds to promote digital health literacy amongst our citizens, so that all citizens can participate, so that we can have an equality of opportunities. User-specific initiatives or perspectives, as well as data privacy, should be part of that. So let's get started. Let's turn this into a program. For these kind of funding programs, we should actually tailor a program with regard to the needs of our users, because this program is meant for our users. For us, it's also important to foster the critical health literacy, because we need an informed citizen, and the citizen should be critical towards the information he or she gets. The KundiG project was developed at the Medical University, and we were supported greatly by other actors. Selbsthilfe, the self-help, BAME, the BMG self-help, NARCOS, SECO Bayern, or SECO Bavaria, were stakeholders and actors in our project, and they were very important because we could not do it on our own. We are not experts on the needs of our users, so we can only benefit from the knowledge of our partners. They work in different fields. They participated in the development, in the control group, in the working group to align the contents of this program. They were part of the public relations management, and they were part of the evaluation. This cooperation took a lot of effort and time. Participation is not always a walk in the park, but together with the 24 actors, we managed to develop a well-structured and a well-working procedure. So this is teamwork to me. I would like to thank all of the team players. Without you, we would not have been able to present this project here today. We want to foster the digital health literacy. We want to foster abilities to navigate in our digital health system. We want to transmit knowledge about the current digital health offers, and we want to foster abilities to make use of these offers. We identified 8 topics. This includes 22 subtopics. As a first step, we transformed these 22 subjects into a modular content system. Data privacy is one module or one part of our module. It's part of the first one, but it's actually a common theme of all of our modules. So, what's the structure of our course system? Well, this is based on INSEA because we had this very positive experience with INSEA. So we're carrying it out online right now via Zoom once a week. So 6 appointments, and every appointment lasts 2.5 hours. We also have a project leader, and during our first stage, we are focusing on people suffering from a chronic condition. Of course, this can be applied to all of the citizens. You don't need to have any previous experience because we introduced a so-called session 0. Before we start our course, we have a pre-meeting with all of our participants online, and then we tell them about the video-specific technicalities of Zoom, how to use the mic, how to unmute yourself, and how to turn on your camera. Of course, we also answer questions. We developed an interactive mix of different methods. We want to convey general knowledge by short presentations of our teaching staff, by using podcasts or interactive contents, and we want to promote actions or the ability to act by using interactive elements such as brainstorming tools. And once again, based on INSEA, we equip our participants with homework. So they get things they can do at home. This is of course on a voluntary basis. They don't have to do the homework. And when we meet again, we do a feedback round and we ask our participants whether everything worked out well or not. We ask them, do you have your electronic patient card yet or not? Did you manage to download a particular app or not? Did you take a look at your cookies? And we get great feedback from them. Thirdly, it's about fostering critical health literacy. So we want to make sure that our participants have a very balanced approach. We want to always present risks and advantages, risks and benefits compliant with our data privacy protection regulations. We have also a diary that we give our participants, so where they find further information as well. So they also get a folder. They get the links that we use whenever we show teaching videos. They can look up the links afterwards. And we also created a glossary. Moving and navigating in this virtual world, we find a lot of abbreviations, EPA, electronic cards, ECs, and you can find all of these abbreviations in the glossary. We evaluate our program. We use qualitative and quantitative methods. For instance, we are observing our courses. We always have 2 monitoring staff members that are observing the atmosphere during the online class. They make sure that everyone's attentive, that everyone gets to be seen and noticed whenever they have a question. And afterwards, we have so-called feedback meetings after the courses are being done. And then we have an exchange between our monitoring staff and our teaching staff, and they point out weaknesses or opportunities, and they make recommendations for improving the workshop. Of course, we also hand out surveys to our participants at the beginning and at the end of our courses with a standardized survey. We use our tool for digital health literacy and our rating for self-efficacy form. And then we ask them about their self-assessment. How confident are they that they will be able to deal with certain issues once the course is done? In total, we have carried out 8 classes with 8 to 13 participants, and 95 people have finished the course. Let's take a look at the social demographic. We can see we have the age of 59 years on average. Women are usually 10 years younger than the men, and 84% of our participants are male. They have a high level of education, 64% of them, and 70% suffer from a chronic condition. So we asked them about their confidence with regard to the future. Will they be able to deal with digital offers after the class? And we have created different boxes from fully applies to partially applies to does not apply at all. And I'm going to show you the 11 subjects of our survey that we hand out afterwards. And as you can see, there was an increase in empowerment for everyone who participated in this course. Let's take a look at the digital support offers. There they have the best rating. So about 97% of our participants are confident, more confident to be able to use digital support offers. More confident than they were before the course. And the confidence with regard to our electronic patient file, there were about 84% that are more confident now to be able to deal with it. Why is it 84%? I mean, the electronic patient card is actually quite vital to our system. So why is that? We are pioneers. We are at the start of this transformation. Not everyone has an electronic health card yet. If I were to ask in this room who has it, I think everyone would take a look and would check whether they have an electronic card or not. Secondly, not everyone has the electronic patient file because not every statutory health insurance is equipped yet or has that yet, or because they have an older smartphone. Maybe that smartphone is not equipped with the right technology yet, the so-called near-field technology. As I said, we are pioneers. This is new territory for us. So, what is the impact of our course? We use the digital health literacy tool to do that, and 3 out of 5 dimensions have increased significantly. We saw an increase in finding reliable information on health. So there we saw a great impact, but it doesn't mean that the other fields had less impact. But when we take into consideration that we only had 6 weeks' time, I think it's quite positive that we saw an improvement in reliable information. We did not see any improvement with regard to navigating on the internet and operational navigation. This might be due to the fact that those people with a high level of education are already very good at that. Self-efficacy has improved significantly as well. So we took a grade system from A to D, how they would rate this class. We got an A, and every participant would recommend this course. We did encounter some issues. This had to do with the sound quality of our videos and the sound quality of our contents. That was due to the fact that not all of our participants did not have very good laptops at home. This is something you should consider in the future as well. Many people had difficulties with Zoom, and they would have loved to have more technical support. These are just our initial findings. If we were to repeat that with another target group with a lower level of education, we might encounter even more difficulties. At the end of our courses, we asked for feedback. We wanted to know what they learned. I just have a collection of feedback here on this slide. Most people are very happy about the information they got from the digital environment. One person said that the fog has lifted, so that mysterious internet, that mysterious kind of content you can find on the internet. So we got to demystify that. We got to take people's fears away. And they've had positive experiences, and their self-efficacy has improved. After these 6 weeks, the confidence was boosted, and they are now capable of coping with digital offers. Their digital health literacy has improved, their self-management has improved. That's being fostered. These classes can be carried out in person and online. To do that, you need quality measures that you need to take. So you need to have some sort of manual, and you need to have an evaluation. And since the digital world is changing all the time, you really need to react swiftly to the current developments. Otherwise, your information is outdated. Training is also very important. We have also learned a lot during this project, and we are excited to see what's to come next. We have just developed this concept for this 6-week course, but you could develop it even further and you could go into more detail. Thank you very much.
Frau Seidel, wenn ich an den Vortrag von Frau Professor Schäffer.
Frau Seidel, when thinking about the presentation of Professor Schäffer, who says health literacy is mainly the way how you deal with information, I think this is exactly the project that we need. I would like to thank you for this project. I think this is the direction in which we are heading, and we should support these projects. And when thinking of the target groups that you have identified, Mrs. Schäffer, people that with a poor educational background, that are socially disadvantaged or older than 65 years, this fits very well